Hi, it's Dr. Janowski for Sonata Aesthetics. Today we're going to do an under eye area with filler. We also call the under eye area many different names, but tear trough is common, infraorbital area. But it's the area where we tend to get a shadowing underneath the eye that makes the eyes look dark or tired, and it's typically hard to cover with makeup, so patients are often frustrated with this area. So it really works quite well to put filler in this little trough area. In this case, Sarah's is fairly mild, but in some cases it can be quite deep and severe. Most patients can get away with a syringe of filler here. And what I like to do is I like to split it into two treatments, and typically about 3 weeks apart. And the reason for that is when we put product in the tear trough area, it's a very thin area, and even a little bit of swelling can show. And so we want to really underdo the area a little bit first, and then we can top it off or finish in the second treatment. Typically there's no recovery from this treatment. It's quite easy. People are concerned about it, but it actually is a super simple, easy treatment that only takes a few minutes to do. And I use a micro cannula when I'm injecting, which means I'm not going to cut through blood vessels here. And generally we don't cause bruising. Once in a while, yes, a little bit, but if we just put a little local anesthetic, one spot on each side, we can use that as our single entry point, use the cannula, and be done within a few minutes. So I'm going to show you how that's done, and first what I'll do is I'll show you how I numb the patient up.
Okay.
So here's the just mild tear trough here. She's probably going to get away with a half a syringe, but I like to use my little buzzer device here against the skin and then place a little bit of local anesthetic, right, one little spot right here, a little tiny poke like that right on the skin. And we can do the same thing on this side, and that's the only entry point we'll need. Again, we can take a little tiny poke. Here we go. And a little bit there. And that's usually the most that the patient's going to feel. Alright. So now that we got our little drop of lidocaine in there with a little bit of epinephrine, we can use those areas as our entry points. When convenient, it's okay to wait a little bit for that epi to kick in. But even if we start right away, we'll see that it's usually quite easy. So I'll have my pilot needle here, right in a tiny little spot right here. Generally, the patient will not feel that. Did you feel that?
Mm-mm.
No.
No, nothing.
And then I like to use Restylane, just plain old Restylane, but I do mix it 1-to-1 with saline. And the reason we mix it is because it thins it out, and we prehydrate the product so there's less swelling afterwards. So I'm going to use my little pilot hole, and we're going to go into the tear trough area and just inject a little bit, inject very slowly. You can stay a little bit deeper. You can go periosteal if you want, super periosteal, or you can stay, you can also add a little bit in the superficial plane, and I do believe it's important to get both planes, both deep to the muscle and over the muscle. We're going to do another little drop right here. Again, we're going to stay over the muscle and help fill in just that slight trough that she's got there. And then we just compress that very nicely, and we just leave it alone. And we'll do the same thing on the other side. And so, again, now we're getting a little bit of blanching from the epinephrine, which is good. Tiny little poke here. Very, very small amount. And then we use our single entry point with our 25 gauge cannula, and we're staying in kind of a middle plane here, and we're just going to inject along the trough, and we're going to layer that product, only injecting on retrograde, on removal of the cannula, retrograde injection. And I've got just a tiny drop left, so I'm going to add a little bit to our superficial plane, tent the needle up towards the skin, and then stay subcutaneous right in the subdermal plane there. And that's it. That's the whole thing. And so we'll see our two little entry points, which will just disappear over the course of an hour or so. Typically we see little to usually no bruising at all. Let me just wipe her down. And because of the lidocaine, sometimes people feel a little funny sensation under the eye. That's just the lidocaine, that's normal. And we just want to let this settle down. Like I said, she's probably done at a half a syringe, but typically what we do is in 3 weeks we come back and we assess the situation, and you can face it toward me, and then we put more in if we need to. So we save a half a syringe, we buy a syringe, save a half, put the first half in, then wait 3 weeks, put the other half in. And again, in a certain percentage of the time, we don't need to put the second half in, and we can use the second half somewhere else. In her case, that's probably going to be true. But that's the entire procedure. That's the injection of the tear trough using Restylane with a microcannula technique.